Thank you so much, Satbir, for the introduction. So as you mentioned, me and Claire worked together many moons ago, and it's been really lovely to be invited to come back and speak together, actually, because we both have this passion for supporting the care of patients with psoriasis. And hopefully we can tell you a little bit more about how your pharmacist can support you with that today. So we thought we'd get you to do a little bit of work for us first. We really wanted to hear from you who supports you with your psoriasis. So who makes up your psoriasis community? There is a QR code there, and I think Satbir shared the message at the beginning with the number. So we'd really like to have some responses from you. This may go completely wrong, but is it healthcare professionals? So is it doctors, nurses? But equally, is it members of your community, your family? Is it the Psoriasis Association? Is it charities that you come in contact with, or support groups? Just to get a sense, I think, yes, definitely family members are absolutely key. Mums are very well versed in applying creams and treatments and knowing what appointments are going on. Really nice to see a pharmacist flashing up there, thank you. Celebrities, that's a really interesting one, actually. I think more and more we are turning to social media and getting information from people on there, so that's interesting. Friends, really key. Psoriasis Association is involved there, so that's really good to know that people are accessing support through them. Great. And NHS consultants, GPs, brilliant. Lovely. Thank you so much for contributing to that. So we'll keep that going, but equally, we're kind of keen to know who does have a pharmacist within their psoriasis community. So next question, you won't be thrown off the webinar if your answer is no, so don't worry, but we're just interested to know if you have a community pharmacist or a pharmacist in some form that supports you with your care. Interesting. Okay, great. So that leads us on, I think, to say, or to tell you a little bit more about maybe how you can access a pharmacist to kind of support your psoriasis care. And I'm going to hand over to Claire.
Thanks, Arlene. So you may not know that you have a pharmacist as part of your psoriasis community, but if you have any medications dispensed at all for you, whether that's creams or oral medication, if you buy any creams from a pharmacy, then yes, you do have a pharmacist as part of your psoriasis community, which is great because we're a really readily available resource. We work in a number of sectors. So you've got your community pharmacists that work in the high street shops that you can all walk into without any appointments. You've got people like myself who work alongside GPs in GP practices. And you've got people like Arlene, who are the more specialist pharmacists who work in hospitals alongside the specialists you may be referred to in your psoriasis journey. And as pharmacists, we are experts in medicines. It's what we do. It's what we live and breathe as pharmacists. And increasingly, we're becoming much more involved in the care of people with skin conditions. And that's true for pharmacists in any sector of pharmacy where they work. So what I wanted to do is give an overview of what community pharmacists do and how you might be able to tap into some of the resources that they can offer. So as I've already said, community pharmacists are an amazing resource that you can walk into almost every day, depending on where you live, and without the need for an appointment and ask for advice. They're trained professionals. We've all done the same pharmacy degree, and they're able to offer any advice on any medication. So whether you're having a side effect from it, whether you just want to know how best to apply your topical therapy or what order to apply things, or what might be the best thing for you to buy or get prescribed, they should be able to offer some advice. They may not be able to answer all of your questions, and if they can't, hopefully they will then get in touch with your GP on your behalf. And if you're if you're getting medication from them already, and be able to signpost you to your GP that way. If you are a vulnerable patient, the community pharmacy will arrange for ordering all your repeat prescriptions for you, so you don't have to do anything, which is amazing. They can also deliver your prescriptions out to you depending on what service your community pharmacy offer. And community pharmacists are getting increasingly more powers to be able to independently manage patients without the need for seeing a GP. So there's lots of prescribing pharmacists that are now working in the shops in the community. So that means that they're now being given the powers to be able to change prescriptions if what's being prescribed for you is out of stock. And we know that stock problems and supply issues are endless at the moment, and it's really, really hard to predict what medication and what topical therapy might be affected. But the community pharmacies are really at the forefront of being able to give the most up-to-date advice on what's available and what they're able to order in, or how long a lead time might be from them placing the order from them receiving it in their pharmacy. So I'd really encourage you all, if you're using regular topicals or any medications for your psoriasis or other medications, so really get to know your community pharmacy and see what services they offer, because it does vary regionally and place to place. So yeah, so speak to them and find out what they can do for you. Next slide, Arlene, please. So I'll talk a bit about my role. So I work in a GP surgery, and officially my title is a primary care network pharmacist, which is a very fancy name for saying I work in a GP surgery. But what it means is that we provide service to various different GP surgeries in a locality, and everywhere in England has a primary care network. And every primary care network in England has a pharmacist or pharmacy technician working for them. So I work in a team of 9, and I work alongside different professionals within the primary care team to provide a holistic care to patients. So we work alongside the nurses in the Aging Well team, the physiotherapists, mental health practitioners, social prescribers, and acute visiting service, which consists of paramedics who will come and do a home visit if you're unable to access and make your way into a GP practice if you're acutely unwell. And we can, signpost you to all these different professions that work together within a GP, without you needing to book a separate appointment with them. We can organise those appointments for you if you end up contacting your pharmacist in your pharmacy team. So a big part of my role is making sure all the medications that your GP surgery prescribes is safe and is relevant for you, and that it matches what's happening with you as a person right now. So we know that if you have a dermatological condition, you may be under a specialist, you may not be, you may be seeing a specialist GP, you may just be seeing your GP rather than any specialist service. But if you are under a specialist, what we do is ensure that all that information from your specialist is transcribed across onto your GP record. And if you do have a skincare plan, we make sure that that's up to date on your repeat prescription if appropriate, and have an accurate documentation in your medical record of what you might be needing if your skin flares. And I think the key message that I want to get out to you, to get the most of your pharmacists in a community and also from your GP practice, whether that's a pharmacist or a nurse or a GP that you might see regularly, is to communicate with them what works for you with your skin, what amount of topicals you need. Maybe you're regularly getting small tubes of a topical, but actually you need a big one, and it's quite stressful trying to get in touch with your GP surgery to order more each time. So if we can get it right from the very beginning, it's much easier for you, it's much easier for us, and we want to basically ensure a smooth transition of care between primary care and secondary care. Another big part of my role is regularly reviewing medication. So if anyone is on a repeat prescription, then they will likely have me calling them up or booking them appointments to sit with me in a room to discuss your medicines. And we also deal with medication requests. So I do all the prescriptions for the GP practice if someone's regularly on medications, and intermittent medication you might request. So it may be that you're requesting a topical that you've not used for a year. So someone like me might call you up and try to find out what's going on. Is your skin worsening? Is it just that you've had a tube of cream that's lasted you a long time and you've run out? But really want to get the most and ensure appropriate therapies being used, and try identify when you might need to see a GP versus when I can just give you a treatment without making you see a doctor. And as I said before, signposting you to other services. We know psoriasis isn't just treated with topicals or oral therapy, and we know that mental health practitioners have a huge role to play in well-being for people with skin conditions, and making sure that you're signposted to the right support that you might need, that can't be offered by a GP and can't be offered by a pharmacist, but it can be offered by someone with more specialist training in mental health. And I think that's all I've got to say at the moment.
So following on from that, I guess I couldn't let Claire take all of the spotlight for the community pharmacist. I thought I'd better let you know what we also do in the hospital. So some of you may be under a specialist service, a dermatologist in the hospital, and increasingly you might start to see pharmacists to repeat your medication if you're on a long-term medication. So we're usually trained as prescribers, and we prescribe medication, but we can also dispense and manage the supply of those medicines for you, whether they're delivered to your home, things like that. I guess a lot of the work is also in the background. So with psoriasis, we know there's been loads of new treatments coming through, which has been really interesting and exciting. And we're part of that journey and helping bringing those medicines to a clinical scenario so that we can actually use them. We are involved in writing patient information and guidelines and setting up pathways of care, and also referring you on where needed. So I think really both Claire and I wanted to just give you some really top level tips for getting the most out of your treatments. We know that everyone's human and it's not always easy, but generally trying to be consistent with your treatment plan. So stick to the plan if you've got one, and trying to create a routine around that. Again, we know that's really hard, but if your medicines are in a certain place where they're more likely to be used, if you keep all your creams in the bathroom or wherever you're likely to use them, for me, if anything's beside the kettle, I'll definitely be going there every day. So it's that kind of reminder to take your medicine. There's lots of apps and really good reminders. And especially if you're on an injectable treatment, that can be quite useful to just keep a diary of when you've injected and when you're next due. Being organised is really key. We know it's quite a burden for patients, having a long-term condition. There is a lot to keep up with, appointments and ordering your repeats, but I guess just trying to come at that, in an organised way, storing your medicines appropriately. Do they need to go in the fridge? Do they need to stay at room temperature? Have you checked the expiry date on them, or have you been using that tube of cream for a year, like Claire mentioned? And just putting in your repeat prescription requests in time just helps to all avoid hiccups with your treatment. If you're travelling, we can offer advice on, how to store your medications, how to travel with cold chain injectables, or provide a letter to help explain that you're travelling with medicines. And I think a key thing for all of us is just communicate with us. We're very happy for questions, and we really want honest feedback. So if that cream is too heavy or too thick or too greasy, or, we can advise on different formulations. If what we've asked you to do is just too many steps and too much to keep up with, we'd rather honest feedback so that we can really tailor the advice for you. Keep a track of your own progress. So let us know what's working and what's not working for you. Some people find it helpful to keep a little diary of knowing what things are are going well and what sort of seems to trigger their psoriasis. Realistic goals is really important. So we want to know what's important to you in order to create or give you the best treatment plan. So is it that you need your face to be clear because you're getting married? Is it that you need your nails to be clear because you need your hands are very much part of what you do at work? Or is it, like Catherine said earlier, that the itch is driving you mad and you can't sleep? So all these sort of things about what's important to you helps us decide on the best treatment for you and how to get the most out of that treatment for you. And please do ask us about the timeline. So how quickly can you expect your treatment to work? When will the creams kick in? When do you need to go back if they're not working? When do you need to seek advice? Or, that kind of thing can be really helpful for you to know. Please do ask for help. So like Claire said, we can signpost you to other supportive strategies. It's not all about the medicines, we know that. And actually, we need to look at this from a holistic point of view and make sure that you're supported in that way. Make sure you attend your follow-ups regularly so that you avoid breaks in treatment and blips in your therapy. And then just if you need more information, don't be afraid to ask. There's so many useful resources out there, and I think sometimes we either bombard you with too much information and give you too many sheets of paper or too many QR codes, and then other times we might not give you enough. So it's just about knowing what works for you and how you best like that information and what information is most useful for you, I guess. So that's just some general top tips. It's been really nice to attend today. We look forward to any questions.